Hello, my name's Phil Morris. I'm the founder of the checkemlads.com charity. I'm here today at the Clatterbridge Cancer Centre with Matt Wakefield and Mark Porter. All three of us are testicular cancer survivors. And what we're going to talk about today is that we do help people going through the cancer, but we're going to go through the questions that get asked a lot. What's it like to be on chemo? What's it like to have scans? What's it like to have blood tests?
I said, man, can you help me out and bring me back to love, bring me back to life? Oh, why should I care? I said, how could you keep me out?
So you've been to see your GP, you've found the lump. He'll then send you for an ultrasound scan. It should be within 2 to 3 weeks. Now, an ultrasound scan is what pregnant women have to have a look at the baby, but they also use them to check testicles. It's a good tool to find any sort of tumour or cancer. So you'll get in there, you'll be asked to sit your pants down, and they'll put gel on your testicles and give it a good scan. That should bring up near enough if there's any sort of cancer, but they probably won't tell you on that day.
Okay, well, it's very straightforward. Just put a little bit of cold jelly on a probe here, run it across the testes, take a couple of pictures. Is that okay?
That's fine.
Okay. Okay, that's fine. We're finished. I'm going to use this paper to wipe the jelly off. Right. Have found a slight abnormality there in the testes. I think it does need some further investigation. Obviously it's best to get this sorted out. So if your doctor will probably refer you to a specialist who in this sort of problem, and then they explain all to you, follow-up treatments, etc. Okay.
Okay.
All right.
Thanks, Doctor.
Okay.
If it turns up that you do have testicular cancer, a lot of things are going to happen in the next maybe 3 or 4 weeks. One of the most important things that you can have is a CT scan. A CT scan basically looks through your whole body to see if there's any tumours anywhere else, whether the cancer has spread. So you have to go in there. It's quite a daunting experience because it's a big thing that makes lots of noise, but it's a really important tool that you need. Right, I'm now going to have blood tests. Get used to these. Over your cancer treatment, you will have lots of them. Even for a long time after, up to sometimes 4 years, they'll be checking your blood to see if there's anything in there. Okay?
There you go, press down.
Thank you. Someone better than others, that was really cool. Depending on what stage of cancer you've got, you might need to come into hospital for chemotherapy. If you've got the cancer early, you might just need 1 day of chemo. If you're quite advanced in your stage, you might need a longer cycle of BEP chemo. Now, I won't go into detail about what the chemotherapy is, but it's basically there to try and get rid of the cancer. Chemo isn't nice. It affects people in different ways. Some men fly through it and go out the other side with a big bright smile on their face. Some men don't go on it very well. I didn't cope with it very well. I lost all my hair, your gums start to bleed, you feel sick a lot of the time. It's different for different people. So when you do come into the hospital, make sure you bring things to keep you occupied, like books or your laptop. You might find somebody who's in here who's got the same type of cancer and chemo as you, so you might be able to chat to them while you're here. Your family might get a bit upset when they see you on these machines, but just cope. They're going to have to cope with it, and you just get through it. Some people get told they're going to go on chemotherapy and actually don't know what it is. Basically, it's a liquid that goes into your hand. It knocks your blood cell down really low, so the tumours die because they're not getting the right supply of blood.
Is it all right if I get your cannula in now, ready for your chemotherapy? Yeah, sure. Right, let's just have a little look at your veins, see if we can find a nice one. That's one okay on. Just going to pull that a little bit tighter. Does that feel okay?
Yeah, that's fine, thank you.
See if we can find a nice vein. There we go. Just going to clean the skin. Might be a little bit cold. that to dry off for a minute before we get the cannula in. You're going to feel a sharp scratch now. There we go. Got that in first time. I'll just make sure that's nice and secure. Once this needle's in, it should stay until the end of your treatment.
Okay.
But you need to let us know if it starts to feel uncomfortable in any way at all whilst you're here. There we go. I'm just going to get you hooked up to this first bag of your chemotherapy now. This is the first bag of chemotherapy I'm starting for you now. So this one's going to run over 2 hours. So I'm just going to set the right rate. There we go. Alright, so as I say, that's running now for the next 2 hours, but you shouldn't have any discomfort or any problems around your ventral site whilst your treatment's running. So if you do have any problems, let us know.
Okay.
We've got your call bell if you need.
Okay.
And just give us a call back.
That's great,
All right.
thanks. Thank you.
Okay.
Well, I had testicular cancer when I was aged 20. I had my left testicle removed and then had that followed up with radiotherapy. During the operation, I did feel alone. I didn't know anyone else who'd had testicular cancer. Days before the internet and all that. I knew of a guy called Lance Armstrong who'd had testicular cancer, worst case, and then went on to win the Tour de France. But I didn't really know anyone who's normal who had testicular cancer.
I had my testicular cancer in '98. I was 29. I had 6 months of chemotherapy. I suppose at the time you just deal with what you're given. If I could go through it, anybody can go through it. And basically, I'm the same really. The only person I knew who'd had testicular cancer was Lance Armstrong and Bob Champion, the jockey. Since then, I've found that there's hundreds who've had it, so it wasn't just me. I did feel a bit down when I was on the chemo, but it's not something that you can't deal with. I did the 6 months, I did my 5 years, and then I got the all clear. Checkemlads for me gave me somebody to talk to. They gave me support. They pointed me in the right direction, and also really, with meeting all the survivors, we all became friends. Today we're outside Vernon's garage in Heswall. We're going to go inside and talk to one or two of the mechanics about testicular cancer, the signs and what to look for.
Okay. Do you guys know how important it is to regularly check your balls for lumps?
Not really, no.
Yeah. Well, best time to check your balls is when you're having a bath or a shower, when your scrotal skin is most relaxed. Do a quick feel between finger and thumb. What you're feeling for, is any irregular lumps or swellings. Some lumps can be harmless, but it's always best to have them checked out by the doctor or GP sooner rather than later.
Okay, so Checkemlads is a charity helping testicular cancer. But I was treated here at Clatterbridge, so it's a place close to my heart. So we try to donate as much as we can, and you should too if you live in the local area. Jade will explain now where the money goes.
The Clatterbridge Cancer Charity is the only charity that raises money to directly benefit Clatterbridge cancer patients across the region. So Clatterbridge receives a standard level of NHS funding, and the money we raise provides over and above what the NHS would be expected to supply. So little extras and big extras really that help the patients, things like hand and foot massages for our patients while they're waiting for their treatment, pioneering cancer treatments. We've got loads of cancer research projects going on this year as well. So really exciting things going on.
Yeah, so if you can spare a few quid and you live in the area, make sure you give it to Clatterbridge.
Pick yourself off the floor, try to be stronger.